Hi, I'm Joel Hunter, and I am a cataract surgeon, which is why today I want to talk to you about cataract surgery. So cataract surgery has come a long way over a long time, and that's because cataract surgery, if you go way far back, it's been around a couple of thousands of years. You wouldn't have wanted one of those older cataract surgeries though. And matter of fact, even up until about 75 years ago, cataract surgery was pretty rough. And then it started getting progressively better and better, and then exponentially better and better until we got to where we are today, where the surgery takes anywhere between 5 and 15 minutes and the recovery is pretty much immediate. So first we're going to talk about what is a cataract. And to do that, we have to draw an eyeball. So this is an eye if we were looking at it from the side, looking out this way. We call it the globe, and on the front of the eye there's this dome called the cornea. This one's a bit flat, but this is basically what it looks like. And then behind that there is this ring of muscle, and that's called the iris. Now the iris is the part of the eye that if you have blue or green or brown eyes, it's this. And all of this is in 3 dimensions. So rather than imagining this as just these little lines here, this is much more of a ring of muscle that goes all the way around, which means this thing in the middle that just looks like a little gap is actually the pupil. And the pupil is, as you probably guessed, what you're looking out of. And just behind that pupil, hiding in the dark so that you can't see it, is this lens inside the eye. And this lens is just called the lens. So this natural crystalline lens inside the eye has the feature, or bug more accurately, of changing slowly over the course of your life. Now up until age 8, it's good. It gets better and clearer and more optically perfect. After age 8, it gets worse and worse. And eventually, over enough time, 100% of people will get to the point where this lens is cloudy enough to be called a cataract. So, the way we fix that, before we do that, we're going to draw in this little extra features over here. This is a ring of muscle called the ciliary muscle, and these little guys, it's a ring of these little things called zonules, and you can think of them much the same way if you've ever seen a trampoline with the trampoline springs that go all the way around it. This ring of these little microfibrils of tissue of collagen, they hold the lens in place. And the reason all that stuff matters is because of the nature of how cataract surgery works. So remember I was saying way back many moons ago, I don't know what you call that when it's years, many revolutions of the sun ago, around the sun ago, cataract surgery just involved getting the cloudy lens out of the way. This is ancient times, it did what was called couching, where they would literally just push the lens down into the eye, and most of the time it ended up in blindness, but every now and then it worked, and so they kept trying it. And even in modern times, originally what they would do is just take this lens and the zonules around it. I should label these so we know what we're talking about. These are the little trampoline springs called zonules. They would take all of that out, and then you didn't have a good place to put the new lens, and that's why people had what were called aphakic spectacles. Aphakic. So phakic, this part means lens, and this means none. And so when you had no lens in your eye, you had to have these spectacles that were huge. And if you've ever seen in old-timey movies where somebody has glasses where their eyes look enormous and magnified, it was because we would take out the old lens, put no new lens in there, and you were missing all of this extra power that you needed. So you'd put it in these really high-powered plus lenses that weighed about 10 pounds in this glasses frame on your eye, and you'd have to wear that for the rest of your life. Fast forward to nowadays, and what we're able to do is actually get rid of the cloudy lens, but leave the support system behind. The ciliary muscle, the zonules, the capsule itself, because this little extra lining right here is called the capsule. The capsule itself, all of that stuff stays behind so that all you take out is the cloudy stuff. Leave behind all the good and supportive stuff, and then in its place you put a perfectly clear artificial acrylic lens. And that lens does not change or age over the course of your life. It stays perfectly crystal clear for the rest of your life. So that's a little tidbit, a little walkthrough of what modern cataract surgery looks like. It's wonderful because you can take a procedure that's life-changing and do it in just a couple of minutes, and very, very safely.